I believe a couple years ago we were just rolling out with enhanced services, and last year we had a few pharmacies that were doing stuff, but really seeing how much pharmacies are engaging with our enhanced services, or oh yeah, I'm in there all the time doing this or that. And then of course now we have some additional programs in my program. So just being able to focus on the additional dollars. And I think we did have somebody that said, like, if it wasn't for enhanced services, I'd be making $1 a prescription. So they really liked that additional revenue and that they could get through EQUIPP.
Welcome to the Pharmacy Quality Solutions Quality Corner Show. Buckle up and put your thinking cap on. The Quality Corner Show starts now.
Hello, Quality Corner Show listeners. Welcome to our PQS podcast. Nick Dorich here, Associate Director of Pharmacy Accounts, and I am joined by Stephanie Hale. We are here to talk about the summer trade shows and how we've been engaging with independent pharmacies at McKesson ideaShare, Cardinal RBC, and Cencora ThoughtSpot. So, Stephanie, let's go ahead. Let's get you introduced or reintroduced to the audience. Can you confirm what your role here is, your role is here at PQS, and your experience in pharmacy, Stephanie?
Yeah, so I am Stephanie Hale. I'm the Quality Programs Manager here at PQS. So my role is primarily engaging with pharmacies to get them into the enhanced services and my programs to get started on some programs in there and earn some additional revenue. Prior to PQS, I was a technician for many years and then went to the PSAO space, and then now I'm here. So a lot of background, over 20 years in pharmacy. So
excellent. Well, thanks, Stephanie. It was great to be on the road with you over the last couple of weeks. You and I were at a couple different shows together and got to be meeting with pharmacies firsthand, which I think is one of our favorite things to do. We've got a lot of new things to share about EQUIPP and how pharmacies can be engaged with patient care services. And I think the important aspect that we like to share, and I think it might be the thing that got the most attention, was how we could help pharmacies be earning money for this care that they are providing for patients in their community. So let's go ahead. The way that we're going to format this show, Stephanie, I've got in mind, what are the top 3 things that we learned here from the summer trade show? What were the top 3 things from our experience with the pharmacies and what we had as takeaways? So whether you were a pharmacy team member that met with us at McKesson, at Cardinal, or at Cencora, we had a lot of takeaways, and we want to make sure that we're sharing some of this information back with our broader audience who we maybe didn't get a chance to meet with at the shows. So, Stephanie, let's go ahead and jump into it. And what was your number one takeaway? What was your number one thought coming out of the trade shows this summer?
So really just, I've been with PQS 3 years. So this is my 3rd summer of trade shows, and just really seeing the engagement and name recognition with EQUIPP is really, has really developed in the past 3 years. So a lot of people know who EQUIPP is now, what they're using it for. And, if their friends don't know about it, bringing them over to tell about the programs we have available.
Yeah, this is really great. And I think, Stephanie, one of the key things that we also saw and experienced was that this wasn't just pharmacists that were knowing about EQUIPP. It was also a lot of pharmacy technicians. Sometimes they're the technician in charge, or they're handling some of the business aspects of the show. Even here on this call, I'm a pharmacist by training and background. You're a pharmacy technician. But I think we really saw and heard from the users loud and clear that this is a team approach that it takes. And for the pharmacies that are doing it well, that delegation of those reporting items and follow-up is key to their success. Any other thoughts that you had based on that experience?
No, definitely. I know we talked to some technicians that were, they're doing a lot with the programs, and then even nurses and other clinical members that are in doing stuff. So it was exciting to see how that work is spread across the team.
Yeah, absolutely. Team effort, always better to go somewhere far together with these programs, especially as the programs are growing. So, Stephanie, as we're talking about programs growing, that might have been another big topic. What would be your number 2 item or takeaway from our summer trade shows and our meetings with independent pharmacies?
Just again, like the difference in each summer is amazing. So, I believe a couple years ago we were just rolling out with enhanced services, and last year we had a few pharmacies that were doing stuff, but really seeing how much pharmacies are engaging with our enhanced services, or, oh yeah, I'm in there all the time doing this or that. And then, of course, now we have some additional programs in my program. So, just being able to focus on the additional dollars. And I think we did have somebody that said, like, if it wasn't for enhanced services, I'd be making $1 a prescription. So they really liked that additional revenue and that they could get through Equip.
Yeah, absolutely. It was very much a rewarding experience for us at these shows to hear pharmacies that they don't only know, they know about these programs, but they're actively working through the programs. And as you said in the prior comments, that they were bringing over their friends or bringing over, classmates, other people that they knew that they were engaging with for these opportunities. Were there any particular comments, Stephanie, or highlights? Were there any, frequent items that pharmacists were telling us or pharmacy technicians? Were there any key items that people were frequently pointing out to as, hey, this is my priority item? Or if there's one thing that you're doing in Equip, what were they highlighting?
Just making sure that they're logging in on a weekly basis. Text messages were another highlight as well, saying, "Oh yeah, I already signed up for text messages. That's I get on there when I get that, etc." And just making sure they're staying on top of things, even if it's just once a week, logging in. They're getting in and engaging with the programs.
Excellent. All right. And I think that takes us to our final point, Stephanie, and the other bit of excitement that we had at these summer trade shows, for pharmacies, they're used to logging in Equip and going through from these documentation opportunities or following up and tracking their My programs throughout the course of the year. But one of the things that we've always heard from pharmacies was, hey, can we do this in our workflow? Is there a better way that we can do this so we don't have to go to another site? And I think this year was the first time where we were able to answer, yes, we have a solution for that. So can you talk to our audience about EQUIPP Copilot, what that experience was like, and some of the feedback that we received from pharmacies about EQUIPP Copilot?
Yeah, so a lot of times, so Equip Copilot sits directly on the top of a pharmacy's workflow. So if they're in a patient, filling a prescription for them, giving them a phone call, it'll tell them right then and there if they have enhanced services opportunities or opportunities for check-ins or blood pressure readings, or even just if they're in any star ratings programs that they maybe earn additional bonuses on. So they can see that right there instead of having to go out to our website or to their PSAO's website to log in. So they can do that right there in their workflow instead of having to, print out a list, do all that stuff and make phone calls, which of course they still can do that if that helps their workflow. But it was exciting to really see that. I actually had a pharmacy come up to me and say, yeah, we use Equip, but the thing that is most annoying to me is that I have to go to this website to do this. And I was like, well, listen, we've got a solution for you. So everyone was really excited about that and looking forward to it launching.
Yeah, absolutely. Well, Stephanie, thanks for the review. And these were really the primary items. We had conversations with hundreds, if not thousands, of pharmacies and their staff members, across the couple of trade shows. The three shows, again, that was from McKesson ideaShare, Cardinal RBC, or Cencora ThoughtSpot. If you came and talked with some of our staff members, we appreciate you. We appreciate the work that you're doing with the patients in your community. We had a lot of great items that we were able to share with pharmacies. And Stephanie, we took a lot of great feedback from pharmacies as well about how we can continue to improve Equip and really best align the services that we're providing in a way that's meaningful for how pharmacies and how the pharmacy staff are practicing the patient care services that they are doing. So Stephanie, a couple of items before we wrap up for today. Already, talked about, hey, what would be some of the recommendations as it goes to Equip and Equip engagement. But we're going to be getting into a busy time of the year with flu shots, Medicare open enrollment. There's a lot of things that happen as we get towards the end of the year. So what should pharmacies be paying attention to when it comes to their Equip engagement and maximizing the benefit of what they can use with our platform?
Yeah, so I think definitely, checking in weekly, et cetera. And then, of course, once Copilot launches, it'll be just right at that busy time of year. So if I'm in there and with a patient and filling for their flu shot, hey, do they need a blood pressure reading as well? So then that way they can go ahead and just do all of that at one time, one trip to the pharmacy. So, just double checking those, making sure when you are doing flu shots or whatever type of shot for those patients that you're also checking in to see if they have check-ins, blood pressure readings, A1C readings, et cetera.
Yep. And while the summer trade shows are done, we certainly have opportunities for pharmacies through our EQUIPP support to do demos, to do one-on-ones, to do group meetings, to go over for EQUIPP. And Stephanie, where is the next meeting when is the next time that we will be meeting with pharmacies, showing off EQUIPP Copilot, and meeting in person to help explain some of these opportunities?
So we will be at NCPA in New Orleans in the end of October. So looking forward to seeing everyone there.
Yeah, absolutely. All right. Well, Stephanie, any final words here before we wrap up? You are, like you said, a pharmacy technician. You've been in the trenches there, and pharmacy is always changing. Healthcare is always changing. It's always a new challenge. But any final words, comments, remarks that you would like to share with our audience about, what's up and what's coming forward?
So just like I said, super excited about EQUIPP Copilot launching to make things a little bit easier on everyone. And just if you haven't already, get your technicians and the rest of your staff involved too. I know a lot of pharmacies like to do some sort of incentive. So if they're earning additional dollars for the pharmacy, passing that along to the technicians as well. And that seems to be effective.
Yep, absolutely. All right. Well, Stephanie, thank you for your time. Thanks for jumping on here to represent the PQS team. We had a large number of our staff getting out to meet with independent pharmacies because there's a lot of independent pharmacies out there that are really thriving and working to provide these patient care services. So again, thank you, Stephanie. Thank you to all the independent pharmacies who met with us at these trade shows. Look forward to our next PQS upcoming webinars, as well as next upcoming episodes on the Quality Corner Show. But that's all for today. We look forward to seeing you next time.
The Pharmacy Quality Solutions Quality Corner Show has a request for you. Our goal is to spread the word about how quality measurement can help improve health outcomes, and we need your help in sharing this podcast to friends and colleagues in the healthcare industry. We also want you to provide feedback, ask us questions, and suggest health topics you'd like to see covered. If you are a health expert and you want to contribute to the show or even talk on the show, please contact us. You can email info@pharmacyquality.com. Let us know what is on your mind, what we can address, so that you are fully informed. We want you to be able to provide the best care for your patients and members, and we wish all of you listeners out there well.